Now let's discuss about the lateral part of the middle part of the Norma Basalis. In the lateral part of the middle part of the Norma Basalis is formed by two bones, the sphenoid bone and the temporal bone. The sphenoid bone here in the Norma Basalis shows two parts: the greater wing of the sphenoid bone, the pterygoid process, and the temporal bone here in the Norma Basalis shows three parts: the petrous part of the temporal bone, the tympanic plate, and the squamous part of the temporal bone. Now let's discuss first the pterygoid process. So this is the pterygoid process of the greater wing of the sphenoid bone. Anteriorly, this pterygoid process is fused, and this posteriorly it is free, and it gets split into two plates, the medial pterygoid plate and the lateral pterygoid plate. The anterior end of these two pterygoid plate gets fused to form a fossa. This is known as pterygoid fossa. Okay, now let's discuss each plate individually. Let's discuss the medial pterygoid plate first. This is the medial pterygoid plate. The medial pterygoid plate has two surfaces, the medial surface and the medial surface and the lateral surface. This is the medial pterygoid plate, and it has two surfaces, the medial surface and the lateral surface, and a free posterior border. This posterior border, when traced superiorly, it splits to form a fossa which is known as scaphoid fossa. Superiorly, this free border of the medial pterygoid plate splits to form a fossa which is known as scaphoid fossa. And when traced inferiorly, the posterior border of the medial pterygoid plate presents a process which directs downwards, and laterally here it is broken in this bone, but here a process is present which is known as pterygoid hamulus. Okay, now let's discuss about the attachment on the medial pterygoid plate. Medial pterygoid plate, on the posterior border of the medial pterygoid plate, on its holes there is attachment of a pharyngobasilar fascia. On the upper part of the posterior border of the medial pterygoid plate, there is attachment of superior constrictor muscle. On the pterygoid hamulus, there is attachment of pterygomandibular raphe. Okay, now let's discuss about the lateral pterygoid plate. So this is the lateral pterygoid plate, same as the medial pterygoid plate. It has two surfaces, the medial surface and the lateral surface. Okay, now the attachments on the lateral pterygoid plate. On the medial surface of the lateral pterygoid plate, there is attachment of deep head of the medial pterygoid muscle. Okay, medial pterygoid muscle. Medial pterygoid muscle is a muscle of mastication. Okay, on the lateral surface of the lateral pterygoid plate, there is attachment of lower head of lateral pterygoid muscle. Lower head of lateral pterygoid muscle gets attached over the lateral surface of the lateral pterygoid plate, which is also a lateral pterygoid muscle, is also a muscle of mastication. So this was about the pterygoid process. Lateral aspect of the middle part of Norma Basalis, what all you can see is the lateral part. I have already told that lateral part of the middle part of the Norma Basalis is formed by two bones, the sphenoid bone and the temporal bone. Okay, the parts of the sphenoid bone which you can see in the Norma Basalis are greater wing of the sphenoid and the pterygoid process. We have already discussed about the pterygoid process, and so let's discuss about the sphenoid bone, which you can see here, the greater wing of the sphenoid bone. Here you can see the infratemporal surface of the greater wing of sphenoid bone. This is pentagonal in shape. Here this is the anterior border, anterolateral, posterolateral, anteromedial, and the posteromedial border. Okay, so the anterior, this forms a pentagon. This is in the form of a pentagon shape. Okay, pentagonal in shape. Okay, so the anterior border of this pentagon, the infratemporal surface of the greater wing of the sphenoid, the anterior border forms the posterior boundary of this pterygomaxillary fissure. This is the pterygomaxillary fissure. So this anterior border of this pentagon, the greater wing, the infratemporal of the infratemporal surface of greater wing of the sphenoid bone, forms the posterior boundary of this pterygomaxillary fissure. Okay, anterolateral boundary, here you can see this is known as the crest of the infratemporal surface of the sphenoid bone. It is rough. This is the crest of the infratemporal surface of the sphenoid bone. The posterolateral boundary articulates with the squamous part of the temporal bone. Okay, the anteromedial part, the anteromedial boundary, it articulates with the, this is the pterygoid process, it articulates with the pterygoid process of the sphenoid bone. Okay, and the posterolateral, this is the posterolateral, it separates this bone from the petrous part of the temporal bone here, petrous part of the temporal bone. So this is the pentagon in shape. Okay, now in relation, when this pentagon is traced posteriorly, there is presence of a spine over here. This is known as a spine of sphenoid. This spine of sphenoid, its relations laterally, the auriculotemporal nerve is related. Medially, we have the cauda tympani nerve and the auditory tube. Okay, and the spine of the sphenoid gives attachment to sphenomandibular ligament. Okay, so in relation to the posteromedial boundary, here we have two foramens. Anteriorly, you can see this is the oval shaped foramen, this is the foramen ovale, and posteriorly here is the foramen spinosum. Ovale, foramen spinosum. The structure passing through the foramen ovale are mandibular nerve, accessory meningeal artery, lesser petrosal nerve, and emissary vein. And the structure passing through the foramen spinosum are middle meningeal artery, meningeal branch of mandibular nerve, and posterior division of middle meningeal vein. Okay, so these are the structures which pass through these foramens. Okay, so that's about the infratemporal surface of the greater wing of sphenoid bone, which you can see here in the Norma Basalis. Okay, so this is forming the lateral part of the middle part of your Norma Basalis. About the temporal bone, which you can see here in the lateral part of the middle part of the Norma Basalis. First of all, here you can see this is the petrous part of the temporal bone. This is the petrous part of temporal bone, which is triangular in shape. It is directed forwards and medially. At the apex, you can see this is the carotid canal here on the here posteriorly we have the carotid canal. The carotid canal runs throughout this petrous part of the temporal bone. The apex of this petrous part of the temporal bone is near the foramen lacerum. This is the foramen lacerum. This is the foramen lacerum, and this is the carotid canal. The carotid canal lodges the internal carotid artery and the sympathetic plexus around the internal carotid artery. Now, the structure which pass through the foramen lacerum are the meningeal branch of ascending pharyngeal artery, the emissary vein, and in the upper part it is related to the internal carotid artery. And in the foramen lacerum, the great petrosal nerve and deep petrosal nerve join to form the nerve of the pterygoid canal, or which is also known as Vidian's nerve. Now let's discuss about we have discussed about the petrous part of the temporal bone. Now let's discuss about the tympanic plate of the temporal bone. This is the tympanic plate, which is triangular in shape. The apex of this plate lies posterior to the spine of the sphenoid, and the base is located over here, which is free. This base forms the anterior, inferior, and posterior inferior boundary of the external acoustic meatus. Okay, and here the tympanic plate also forms the posterior part of the mandibular fossa. Okay, so this is the mandibular fossa, and here you can see the tympanic plate is forming the posterior part of this mandibular fossa. This is the mandibular fossa. It is formed by this anteriorly by the squamous part of the temporal bone and posteriorly by the tympanic plate of the temporal bone. Okay, this mandibular fossa here the head of mandible articulates to form the temporomandibular joint. Here you can see a tubercle is present. This is known as articular tubercle. This articular tubercle provides attachment to lateral ligament of temporomandibular joint. So this was about the lateral part of the middle part of the Norma Basalis. Okay, one thing that I missed here is I have told you that this is the infratemporal surface of the greater wing of the sphenoid. This infratemporal surface of the greater wing of the sphenoid separates with this is the petrous part of the temporal bone. Here you can see a sulcus is present. This is known as sulcus tubae. This sulcus tubae is related to the cartilaginous part of the auditory tube. Cartilaginous part of auditory tube. This area is known as sulcus tubae. It is like a sulcus. It is known as sulcus tubae. That's all in the middle part of the Norma Basalis.